Hello, everybody, and welcome to the lab. I'm Kel, and I'm here with Cody, and we're back to talk about the stupid RFK Jr. stuff again. But first, how are you doing today, Cody?
Pretty good. Coming off my 48-hour ketamine high. Uh, just kidding. For anyone without context, I've been doing ketamine treatment, and because of scheduling, like you're supposed to do it twice a week for the initial like 4 weeks, and usually it would be spread out a little bit, but because of my schedule, because their schedule. It's back to back. So it's like my first session is 10 a.m. on Tuesday. The second one is 1 p.m. on a Wednesday. So it's like just enough to get out of my system and then go back into it and
Man,
then just feeling loopy. So it's just like today is my first day of not being high on something. So yeah, fun times.
it's
But
fun.
it's been good. I feel like it's been um helpful already in comparison, like as far as like how quick it has been or like how helpful it's been initially versus like the TMS. It was just like waiting. And that just shows like everybody's different. Some people, TMS was like the thing. Some, ketamine is the thing. So I think the ketamine tends to be is what is probably more helpful for me. But yeah.
Well, that's cool that it's working so fast.
Yeah.
Well, or like that you're starting to see the benefits already. I know that can be so freaking frustrating when you can't tell or you're
Yeah.
just waiting. So, but
Yeah. Or you're like, am I crazy? Why is everyone else like, oh yeah, it was so helpful. I mean, not everyone, but they always say like there's a small percentage that, and you're like, oh cool, I'm like that small percentage. I
that
get it. Um, so yeah. But how are you? How's recovery and surgery going?
it's going good. I am off all the pain meds, so I stopped taking those Monday, I think. Um, but that's it. Not feeling bad or anything really. Um, yeah, it's kind of just annoying now because now I just have to wait and wait.
Yeah.
But I feel okay. But I've been trying to like walk, so Maddie and I have still been going to the gym at like our normal time. Just I walk on the track instead of lift. She goes off and rubs it in my face for lifting. No, but it's nice to kind of keep the routine, just because I think I would go crazy without it. So it at least gives me something to do. But yeah, it's been a lot quieter of a week for me, so it's been nice. Been able to kind of get into things a little bit more. But I have been so freaking tired lately. I don't know what's going on. So that's the only thing. But
Well, I wonder, like sometimes with having a histo, some people actually have to like up their doses after histos, whereas a lot of people think they have to lower it, but it just depends because sometimes your, you know, the ovaries are actually producing more testosterone sometimes, and so once you get rid of those, sometimes you gotta bump it up. But might be something to look into.
I might. I think I don't know what the hell it is. It also could just be like down, like we're reaching that point in winter that it's just can it be over now?
Yeah,
But I don't know how much of it is like the world on fire or stress or something's actually going on in my body. I feel like it's so hard to narrow things down anymore.
oh yeah, I get that.
But yeah, I know I'm talking to someone who understands, but damn, I'm like, if there could just be a couple less variables, that'd be nice.
Right?
Keep
If we
something
could just,
consistent.
yeah, break it down so we know exactly what's going on. Um, yeah, not the easy part, but I think definitely a lot of it is the winter aspect of it. At least we're approaching almost
Well, it's getting brighter.
springtime.
It's getting brighter. So we've
Yeah,
already turned the corner. We're getting into longer days, but
yeah.
and I'm actually going to be outside a lot more starting next week. So I'm hoping that helps, even with kind of the crappy. Like we have snow on the ground still. Um, So that'll be a different kind of annoying, but the sunshine should help.
Yeah, yeah, yeah. We don't have snow, but um, it's still been rainy. It's sunny today though, but at least like it's the days are longer. You know, like you mentioned, that's helpful, 100%
Yeah.
helpful. So yeah, so should we dive into
One thing,
things or
we
oh, go.
did, but one thing I wanted to say, and I know this is probably pretty niche because I don't know how many people are into watching and following competitive bodybuilding, but Sam Sulek had his debut, and
Mm,
it's I feel
yes.
like a fitness guy who's been like a fitness influencer for forever, but this is his first time actually stepping on stage, and I wanted to see what you thought.
Yeah. So I think there's a few things to remember. So one, he's young and on, the steroids, and there's been a lot of controversy around his use just because he's so young and people are, one, they love to hate, but two, there's genuine concern about his health and his influence on younger people and using steroids and stuff like that. I think those are all valid. But
Mhm.
from like a bodybuilder perspective, I I think people confuse because he's been an influencer so long and him basically doing his first show as like a pro when it's literally his first show. So if you
Yeah.
think about your first show and how you felt, how you looked, all that stuff, you know, it's going to be way different as you get experience. And I think people just figured he'd be experienced out of the get go. I mean, he did win first
Mhm.
place, but I think people were expecting more. And I think that, you got to remember not only is he basically a baby, but it's his first show. So he
Yeah.
looked amazing for his first show.
Yeah.
They compared him to maybe like Chris Bumstead in his first show, and it was pretty damn comparable.
Mhm.
Uh, so yeah, what are your thoughts?
Oh, I agree with you, and um, but the one I do think people like to tear him down just because he's someone who is it is his first show, and there's so much talk about him as like the future of bio. Like it's I feel like it's so much hype, and that is always going to be really hard and put that much pressure on like a kid, like you're talking about, is like kind of crazy. Um, I did think his legs looked crappy, but other than that, I looked pretty good. um,
Yeah, and I think too, it's just like I think with time and maturity, his legs will get better. I
oh,
think,
and who knows how much it's posing or
yeah.
conditioning. Sorry to cut you off, but
Oh no.
that was the one thing I thought about.
Yeah, it was interesting how he had like no separation in his legs, and it could have been a conditioning issue. Like maybe could have been just a little bit leaner. I think people were also trying to compare his physique and how he looked like on Instagram and stuff in comparison to how he looked in real life. It's like he still looked fucking amazing in real
Yeah,
life, but of course, there's filters, there's everything with Instagram. You can manipulate things, even if you don't quote unquote edit them. There's ways to like turn up the grain, turn up the sharpness that are going to make things look a lot crazier. So even if he didn't like Adobe Photoshop his shit, uh, there's a certain amount of adjusting you can do to still make it look
plus your
better.
like your angles online, like
Right.
like he's not a like that's what he does, right? He wants to look good on the internet, so
Yeah.
that's
He
and
knows how to
he's
do
successful at that. Yeah.
that. Yeah. So he's just doing his job essentially. But I do think like I would say the main concern would just be his influence on young people and being careful with their health and not considering it because when you're young like that you don't think about you know potential consequences because you feel like it's such a long way off for you getting old. It's coming from someone who's now old and like just think like I never thought I would be this age, and you just don't think about the future in that far ahead of yourself. Like even as someone with anxiety, you don't think you're ever going to be that person that's that age. And so I just know as a young person or a previous young person, that's not something that, we generally think about too much at length. So yeah, but He looks
Absolutely.
great.
Yep. Yep. Exactly. But sorry, we can definitely go into our actual topic now. I just wanted to kind of hear your thoughts on him, and but yeah, and I think he's going to be at the Arnold
Okay. Oh
amateur.
yeah,
I think he's
yeah,
doing
he
the amateur Arnold
qualified. Right.
um,
Yeah.
this next week, 2 weeks maybe.
Is that a like a pro qualifier or like I don't even know because you don't hear about anyone competing in the amateur Arnold. Like,
No, I think it's I think there's a couple cards like pro cards at the amateur Arnold, but I think it's an invitational. I
yeah,
thought.
you have to qualify for it. So
Right.
is it kind of like nationals? Like, I feel like I should know. I feel like it
I
replicates
think it's just a
nationals.
big one. Yeah, I
Yeah,
think it's just trying to replicate. I know they want it to be like as big as like the O, like they want it to be that kind
right.
of thing, and like so they want to build it up like it's something, but it's just another show, I think, but
Yeah,
a lot of money behind it.
yeah. It's almost. I mean, it's getting there. I feel like it gets a more bigger or more known each year. I mean, it's the Olympia and the Arnold. Those are the two most
Yeah,
well known shows. So I would put them in like, Olympia, Arnold, like so close.
yeah,
They're both very prestigious. So
absolutely.
yeah, but speaking of Arnold, I don't know why.
Hey, he did try to make America great again or
Yeah,
healthy again.
healthy
He had a
again.
lot of really cool policies for California, but
It's
let's talk
like,
about someone who doesn't.
yeah, well, I mean, it depends. I might play a little devil's advocate here, but at least it's funny because people forget that Arnold was a Republican in
Mhm.
California, and it's just weird to think about because you know you wouldn't think, yeah, oh, Arnold Republican, but then also he's very liberal at the same time, so he has like a good balance of things in a world where we have a lot of polarization and we're very tribal. To think about how middle of the road Arnold was is something that we couldn't even really like fathom now.
Right.
So yeah.
I agree. It feels like there aren't very many politicians like that who try to hold that center ground so
Right.
stringently.
And oddly, sorry, this is really funny to me, but never in my wildest dreams did I think that Mike Pence would be someone who would try to ride that. I don't know if you've seen recently where basically he's brought it upon himself or whatever to kind of like praise Trump where he deserves it and then fight against it where he's against it. And I'm just like, I remember the days where we used to think Mike Pence was scarier than Trump, you
Yeah.
know? And now Mike Pence is like, nah, I'm gonna I'm gonna fight for, what is I think is right and call him out when it needs to be done and then praise him when I agree with it. And it's just like, you go, Mike Pence. Like, I don't think there's not much I'm gonna agree with this guy on, but at
Yeah.
least he's keeping to his values. That's something to be respected.
I have not heard about or thought about Mike Pence in a very long time. I feel like he disappeared from my newsfeed somehow.
Yeah, I've seen some things here and there, but it's just been like the surprise of him having the balls to stand up to Trump. And he stood up to Trump when it mattered a lot, towards the end there. And he got excommunicated from the cult. So I
Yes,
think
he did.
that kind of opened his eyes a bit, when you've got a mass crowd of people, shouting like death to Mike Pence, like storming the Capitol, that kind of opens your eyes a little bit.
Yeah, it's a warm awakening, or no, just a really bad awakening. It's
Yeah.
like the worst possible one you could have.
Yeah. So, you know, it's just interesting to see his stance. So if anyone is curious, look up like Mike Pence stance with Trump, and you'll get to kind of see a little bit of what I'm talking about. Um, but yeah, like I said, not something in my wildest dreams I thought I would see.
How things have changed. How things have changed. We
Yeah.
can never predict the future.
No. Nope. And not as much as our anxiety likes to pretend we can. We cannot.
Right.
So yeah. So outside of Mike Pence, recently we had Kennedy confirmed as the health secretary, and so we just wanted to kind of go through some of that. I've seen a lot of things flying around. Some things, uh, a lot of panic, a lot of emotions, and so I think figured we would talk about it. And also, I feel like context is important, and there's been a lot of that that's been exited or just like subtracted from the conversation. And yeah, I think the main thing that I want to like disclaimer this with is that all like concerns and shit are valid, but we also want to be careful not to be who we don't want to be like. In the same way that the right takes things out of context and thinks that kids are having sex reassignment surgery in school without parents' permission, just in a day they come back, the opposite gender, they're screaming that because that's what they heard and they don't, take the context behind it. They don't do their own research. We have to be careful not to do the same thing when it comes to what the other side is doing and just not hate everything because it's coming from the other side and, taking into account like everything from all angles instead of just going into complete like panic, fuck this mode,
Yeah. Because that doesn't make it feel good either.
No, we've got enough things to be worried about. And it's hard when you're getting hit with a lot of panic and like things maybe taken out of context because that's what the media does a lot of times too. It kind of like tries to put that into your head. If you just read the headlines of the majority of things going around, yeah, they make you panic. That's why you click on it because you want to know what's going on. Some people don't click on it; they just take the headlines. So it's not productive to help make actual change happen, right?
That's correct. So did we want to go ahead and pull up?
Yeah, I will share this. All right.
For
So
our friends on YouTube.
yes, if you are on YouTube, you can see what we are looking at. So if you're on Spotify, you can listen. You might want to check out the YouTube video later. But this is the thing on the White House website establishing the president's Make America Healthy Again commission. So this was the executive order that was put out that I've seen a lot of conversation around, a lot of emotions, reactions, and stuff like that. So I figured we could just kind of go through it. What do you think, Kel?
So I have looked at it a couple of times, but not read it in complete. I will. I said I will be upfront, but yeah, I feel like it's one of those things where we all are aiming for the same thing. We're aiming for the same goal, and we're just. I don't understand how we took those turns sometimes. You know what I mean?
Yeah.
Do we want to just kind of go through it by point, or do we want to just do overall reaction and then get it?
I mean, we could start we can summarize things if we need to, but I figure if we
Yeah.
just kind of go through it, then that leaves less things to take out of context, I guess. I feel like a lot
Right.
of people maybe haven't gone through the whole thing, and it's probably productive to do so.
All right, let's do it.
So let's see if we can just be patient, grin and bear it, get through it. I know our attention spans are about 3 seconds long, according to my Instagram statistics, but or analytics. But we got to pay attention a little longer than 3 seconds. So yeah, do you want to start? You want me to start? How should we do
Yeah,
this?
you can go ahead. So the first one is or well, I said you go ahead and then started talking.
um, so yeah, first section. This outlines the purpose. So of course, the top, it says by authority vested in me as president, by the Constitution and the laws of the United States of America, it is hereby ordered. So we have Section 1 purpose. Um, and it talks about, so this one's the longest one. So well, we'll just go through. So, purpose: American life expectancy significantly lags behind other developed countries, with pre COVID 19 United States life expectancy averaging 78.8 years and comparable countries averaging 82.6 years. This equates to 1.25 billion fewer life years for the United States population. 6 in 10 Americans have at least one chronic disease, and 4 in 10 have two or more chronic diseases. An estimated 1 in 5 United States adults lives with a mental illness. Um, do you want to switch off and like read the next paragraph, or do you want me to keep
Yes.
going?
No, I can go. So these realities become even more painful when contrasted with nations around the globe. Across 204 countries and territories, the U.S. Has an average standardized incident rate of cancer in 2021, the highest average. Um, Nearly double the next highest rate. Further, between 1990 and 2021, the U.S. experienced 88% increase in cancer, the largest percentage increase in any country evaluated. Um, Asthma was more than twice as common in the U.S. as most of Europe, Asia, and Africa. Autism spectrum disorders, the highest prevalence in any high-income countries. Similarly, autoimmune diseases such as inflammatory bowel disease, psoriasis, and multiple sclerosis in, are more commonly diagnosed in high-income areas such as Europe and North America. Overall, the global comparison data demonstrates the health of Americans is on an alarming trajectory that requires immediate action.
All right. Should I just read the next part?
Yeah, sure.
um, this concern applies urgently to America's children. In 2022, an estimated 30 million children had at least one health condition, such as allergies, asthma, or an autoimmune disease. Autism spectrum disorder now affects 1 in 36 children in the United States, a staggering increase from rates of 1 to 4 out of 10,000 children identified with the condition during the 1980s. 18% of late adolescents and young adults have fatty liver disease. Close to 30% of adolescents are pre-diabetic, and more than 40% of adolescents are overweight or obese. And can I just make a little comment here with this one?
Mm-hmm.
When it comes to autism, we're not taking into consideration the fact that we're better at diagnosing it. You know, there's a reason the rates are higher. It's not necessarily due to outside factors, but the fact that we're looking for it and we know how to identify it. And it's just testing is still hard, but it is more readily available than it used to be. And I think they're not doing the greatest job factoring in those things. So, yeah.
Well, and sorry to go on a small tangent, but that's the same bullshit they try to pull with like transgender and LGBT stuff. Is like the numbers are so much higher than they were, and it's just because people are more comfortable, right? And I think that's what happens with a lot of these people who are evaluating the data who don't necessarily know, aren't trained to evaluate the data.
Right. And I mean, the things that are accurate are probably things having to do, with diabetes and fatty liver disease, because that is something that we can physically see is different.
Right.
Autism isn't something that you can just look at someone and be like, oh, they definitely have autism. It's not how it works. Whereas,
What? No.
okay. Yeah, it just disconnected my camera. Sorry about that.
Okay.
I think it's because I minimized the studio window, and then it was like, "You're not using this." I'm like, "I'm reading." um, Sorry, no, I know not to do that. Anyways,
You're good.
so as far as obesity and stuff like that goes, like we can it's tangible. Whereas autism, that does rely on studies and statistics and reporting. So yeah.
Absolutely.
Um, yeah. Anyway, sorry, we can keep going now. Do you want to read
Yeah,
the
sorry.
next one?
Can you pull it back up?
Oh, dirt. Yeah. Sorry, guys. My computer shut my camera off. Okay.
Oh, that's okay. That's okay. Alrighty. So we're at. This poses a dire threat to the American people and our way of life. 77% of young adults do not qualify for the military based on a large part of their health scores. 90% of the nation's 4.5 trillion in annual healthcare expenditures is for people with chronic and mental conditions. In short, Americans of all ages becoming sicker, beset by illnesses of our medical system not addressing effectively. These trends harm us, our economy, and our security.
I think we skipped a paragraph there. So um, above that one, it talks about, unless you read that and I wasn't paying attention, the health burdens. So
Yeah, yeah.
the health burdens have continued to increase alongside the increased prescription of medication. For example, in the case of attention deficit disorder, attention deficit hyperactivity disorder, over 3.4 million children are now on medication for the disorder, up from 3.2 million children in 2019 to 2020. And the number of children being diagnosed with the condition continues to rise. So I think this is another thing with, like autism. It's because we are able to test for it and recognize it quicker, sooner, that sort of thing. That also being said, I do think there is an environmental factor at play in the fact that we are on screens, children are on screens constantly. And in the same way that our own attention spans as adults has decreased by being on social media, like obviously that's going to have an impact on everybody, children included, because they're being constantly stimulated. If you think when we were younger, you went for a car ride, you had zero stimulation. No tablets, no TV, no, you were bored out of your fucking mind and it was awful. But now kids have tablets, every like phones at their disposal. They're constantly playing video games, not just like Mario Kart. They have VR. They are in a different world, like constant stimulation is what they expect now. So that's why, attention spans are so fucked. So what part of that is a product of our environment and what part of that is biological? I think that's a bigger study to really know what is actually going on. Maybe they'll do that. I don't know.
I wouldn't hold your breath.
Yeah.
uh, yeah. So, yeah, yeah. Well, and also that we didn't talk about how like medication is also like changing so much, and yes, I do believe it is overused, maybe, but like, but jumping ahead of myself. I'm jumping ahead. Let's keep going.
Oh, it's fine.
uh,
I figure we'll
but
probably go into discussion as we go. So yeah.
Yeah, perfect. Well, to fully address the health crisis in America, we must redirect our national focus in the public and private sector towards understanding and drastically lowering chronic disease rates um, and ending childhood chronic disease. This includes fresh thinking on nutrition, physical activity, healthy lifestyle, over reliance on medication and treatments, the effects of new technology habits, environmental impacts, food and drug quality and safety. We must restore integrity in the scientific process by protecting expert recommendations from inappropriate influence and increasing transparency regarding existing data. We must ensure our healthcare system promotes a health rather than just managing disease. And that paragraph I like.
Yeah. I was like, there's definitely a lot that I agree with there. I do think that, you know, prescriptions are, first line of defense for a lot of things. And from personal experience over this year, I experienced that. And that can be frustrating in and of itself. But before we get into that. There's another section that we can talk about that. But to continue on from there, so this starts section 2 policy. So it shall be the policy of the federal government to aggressively combat the critical health challenges facing our citizens, including the rising rates of mental health disorders, obesity, diabetes, and other chronic diseases. To do so, executive departments and agencies that address health or healthcare must focus on reversing chronic disease. Under this policy, should I just read these policies?
Yeah, sure.
Okay. So A, all federally funded health research should empower Americans through transparency and open source data and should avoid or eliminate conflicts of interest that skew outcomes and perpetuate distrust. So like that's something like I'm cool with. We need transparency because, big pharma is big pharma. And as much as some drugs are useful and helpful, we also have to remember money, right? It's always going to be a factor. So being able to have transparency and make more informed decisions is always good. So B, the National Institutes of Health and or health related research funded by the federal government should prioritize gold standard research on the root causes of why Americans are getting sick. C, agencies shall work with farmers to ensure that United States food is the healthiest, most abundant, and most affordable in the world. And D, agencies shall ensure the availability of expanded treatment options and flexibility for health insurance coverage to provide benefits that support beneficial lifestyle changes and disease prevention. And that is one that I wanted to emphasize in the fact of the prevention aspect of it. 100% we need that also as personal trainers. Hey, that might mean insurance covers personal training and that
Right.
sort of thing, which would be awesome. However, it's hard to know, especially with all the budget cuts going around, how much of this is realistic and is actually going to be able to actually be implemented. The things with the food system and agriculture is something that I've been pretty passionate about for a very long time. I don't know if you've ever watched Food Inc., Omnivore's
Yeah.
Dilemma, all that stuff. This is exactly what they're addressing. But the thing is, how many years has it been since that film has been out? And nothing has changed besides people are more aware. So, we're making maybe slightly better choices or voting with our dollar a little bit more. But yeah, we're still getting sicker.
Yeah, and I agree with you 1000%. I think a lot of this sounds great, but I don't understand how we can release this at the same time where all of our government's getting gutted currently and people are losing jobs. I'm like, who's gonna do this?
Yeah.
Um, so all the a lot of the sorry, a lot of the money even in funded research has been frozen. I don't understand because it just seems like we're taking actions directly to shoot ourselves in the foot.
Yeah. Yeah. And I know, uh, I, yeah, I have nothing. We'll address. I'm trying to save
And the
time before.
affordability is such bullshit because it's we still can't afford food. I was just talking to someone this morning about how food prices just it's not getting easier. It's hard. Food prices are really bad.
Yeah. Yeah.
It's so expensive to eat.
Yeah. And unless they have some sort of plan that they come up with that we do not know about, but why haven't we implemented this plan already? And it's not something that's going to be quick. It's going to, by no means, it's just not possible. But yeah, do you want to read section 3?
Yeah, we scroll up a little bit.
Yeah.
All right. So, establishment of and composition of the President's Make America Healthy Again Commission. This hereby establishes the commission chaired by the Secretary of Health and Human Services with the assistant to the President for Domestic Policy serving as the executive director. In addition to the chair and the executive director, the commission will include the following: Secretary of Ag, Secretary of Housing and Urban Development, Secretary of Education, Secretary of Veteran Affairs, Administrator of the Environmental, the EPA, Director of the Office of Management and Budget, assistant to the president's deputy chief of staff for policy, director of economic council, chairman of council of economic advisors, director of the Office of Science and Technology Policy, commissioner of Food and Drug, director of the CDC, director of the NIH, other members of the administration invited to participate at the direction of the chair and executive director.
Yes. All right. So, and then section 4. So, fighting childhood chronic disease. The initial mission of the commission shall be to advise and assist the president on how best to exercise his authority to address the childhood chronic disease crisis. Therefore, the commission shall A. Study the scope of childhood chronic disease crisis and any potential contributing causes, including the American diet, absorption of toxic material, medical treatments, lifestyle, environmental factors, government policies, food production techniques, electromagnetic radiation, and corporate influence or cronyism. B. Advise and assist the president on informing the American people regarding the childhood chronic disease crisis using transparent and clear facts. And C. Provide to the president government-wide recommendations on policy and strategy related to addressing the identified contributing causes of and ending the childhood chronic disease crisis. Any thoughts on that section?
I don't. It's saying a lot of stuff, but it's not really doing anything. You know what I mean?
Yeah, I think the part that can be a little red flaggy is when we're talking about. So this is not to say that I don't think this is something we need to still be aware of and look into, but we have the potential to fall into basically a rabbit hole of not making any changes or just creating distractions when we're talking about some things like, what would, toxic materials, environmental factors, electromagnetic radiation, that sort of thing. How are we going to study this? And I think that's ultimately what it comes down to,
Yeah,
because
exactly.
obviously we know there's toxins and that is not, promoting health, but how much is like a level we can withstand without causing health problems, or how are we going to study the actual impact without just like taking everything away or not being able to take anything away because we just can't really productively study it to begin with. I don't know.
Yeah, 'cause they essentially listed every single thing that can affect someone's health. Like, I don't. It's just so much. And again, we're making government smaller. We're getting rid of all these funds. We're cutting all these budgets. Like, how?
Yeah. Yeah. And maybe that's something they're going to have a little powwow about and just like talk about, because they're not really on the same page, I feel like, in this,
No.
in this order with this commission versus what is happening right now. So, like, y'all need to have a meeting. So, yeah, let's see. Do you want to go down to section 5?
Yeah, so the initial assessment and strategy from the commission. So A, we want to make our children healthy again. Assessment. So we're going to, within 100 days of the date of this order, the commission shall submit to the president through the chair, blah, 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 the make our children healthy again assessment. So what this assessment is going to do is identify childhood chronic disease compared to other countries, assess the threat of potential overutilization of medication, certain food ingredients, certain chemicals, certain other exposures posed to children with respect of chronic inflammation, and establish mechanisms of disease using rigorous and transparent data. So can I just say that this is stupid? So this is your red dye that they want to get rid of. This is all of his wild conspiracy theories. He's like, and I love how they're just saying certain things. Like it's completely at the discretion of RFK. It's like whatever crazy bullshit he wants to get on today. Let's go study it. And now it's this. Anyways, I'll get back on. Um, so we're going to assess the prevalence of the threat posed by the prescription of selective sarin, SSRIs, antipsychotics, mood stabilizers, stimulants, and weight loss drugs. So Ozempic and all other mental health medication. Um, Identify and report the best practices of preventing childhood health issues, including um, thorough proper nutrition, or through proper nutrition and promotion of healthy lifestyles, evolution of the effectiveness of existing educational programs with regard to nutrition, physical activity, and mental health of children, identify and evaluate existing federal programs and funds intended to prevent and treat childhood health issues, ensure transparency of all data and unpublished analyses related to the childhood chronic disease crisis consistent with applicable law, evaluate the effectiveness of current government childhood health data metrics, including those from the federal investigation of or federal interagency forum on child and family statistics and the National Survey of Children's Health, restore the integrity of science, including eliminating undue industry influence, releasing findings of underlying data to a maximum extent prohibited under applicable law, increasing methodological rigor, establishment of framework of transparency of ethics review on industry funded projects, the Make America or Make Children Healthy Again strategy. Within 180 days of the data of this order, the commission shall submit to the president through the chair, based on the findings of our Make Our Children Healthy Again assessment described in subsection A of this document. The strategy shall address appropriately restructuring the federal government response to childhood chronic disease crisis, including ending federal practices that exacerbate the health crisis or unsuccessfully attempt to address it, and by adding powerful new solutions that will end the childhood chronic disease. In 180 days, they're going to end childhood chronic disease.
Nah, I
Stupid.
think that's their evaluation
Oh, they'll have their
time. Like,
plan by then.
yeah, not to say that it's gonna be like 180 days. It's gonna be over. It's just like they're basically it's a blueprint. I think. Yeah.
Yeah. Um, Finally, the chair may hold public hearings, meetings, roundtables, and similar events as appropriate, and may receive expert input from leaders of public health and government accountability.
Any thoughts so far?
I hate it. I hate everything about it. Well, not everything. I think helping with children's chronic illness is great. That'd be cool. If we got more data, that'd be cool. But this is kind of putting everybody on a level playing field. I feel like it's making, which is a bad thing when we're talking about science. Just because scientists should have more to say and get to weigh in more than anybody. Like, I just don't understand his thought process. Well, no, I understand the thought process. I just think it's stupid. I think it's stupid.
I mean, personally, I think this is an effort to study these things, not just to like, say these things, come with like, oh, we already have the facts and know what to do. This is just like a blueprint of how are we going to assess like what is causing things, like assessing the root cause. Um, and also, assessing the root cause also means assessing, you know, issues with access to things, income, you know, inequality, that sort of thing, food deserts. Uh, that's what I would assume or would want to assume that they're also going to assess those things, because it talked about like environmental factors. That is one of them. Where you live can make a big impact on your health, what's available, what, not just like the toxins, but, you know, like what do you have around you? Um, so if we're talking about, like the little things when it comes to how our food is made, the dyes and all that stuff, it potentially it has, you know, a way to just be a distraction and not get anything done. But I'm hoping that that's not the first priority, even though it's like, oh, we got red dye number 3 banned. But I hope they address the root cause before we go into like what sort of ways we're, you know, making ultra processed food just like a little bit healthier kind of thing.
I guess I think a lot of this is putting like the date like it's essentially saying all the data that we have is n- not good, right? Is taking corporate funds, is affected by industry or whatever, and I feel like a lot of that is saying is remo- is setting up to remove all existing structure with the science. And I'm not saying it's perfect, but I do think that right now we do a pretty good job of getting science researched. Like we're getting data, we're getting all this information, but we're not using it. And I've I that's where I worry, because I've seen the people who he's associated with, and it's like, well, if we don't talk about, like, I literally saw this news clip from uh, one of Robert Kennedy's like kind of associates, one of his people that he like brings along to give all of his science, and it was essentially saying, well, if we don't look at the data from um, miscarriages and infant mortality of African American women, then the numbers are really good, and that really sets it up to be like, well, then that's the problem, and we don't need to worry about it. And that's where I fear, and that's what a lot of the language in this makes me nervous about. So
Yeah. Yeah. I mean, that's fair. I think it's just like we don't know what's going to happen yet and what they're going to take into account. Uh, we can hope that they're going to look at everything and not just like miss the target completely. But again, none of this has happened yet, so we're just like, but we just have to wait and see. And, our system currently obviously is fucked. It's not working. So we do need change. Whether we like it or not, change is always hard, but there's something that needs to happen. Uh, we don't know where to start, obviously. um, and we don't want to start in the wrong place. And it's hard because we don't have control. We're relying on people in office to do the good work, and we just have no trust. So it's hard to just, especially with the current administration, it's hard to trust anyone. And although we have to remember, like, oh, Kennedy actually used to be like, he ran as a Democrat, and if he wasn't in the Trump administration, would we be reacting the same way? That's also something to look at. So it's like,
he still has a worm in his brain, though. Like, oh yeah, I
he's
wouldn't.
he's a little
Like,
nutty. Yeah. Um, but there's a lot of nuts in the White House, and there's been a lot of nuts in the White House. So, you know, I don't know that we can trust him any less. I don't know that we can trust him anymore. It's just like one of those things we have to see what their actions say. And it sucks that we have to like just wait. But getting ahead of ourselves isn't helpful either, I feel. So, yeah. Let's see. I just accidentally. Oh, there you go. Should I read the section 6?
sure.
It's very small. Should I just finish it up?
Yeah, I just wanted to knock her on out.
uh, hey. Section 6, additional reports. So, following the submission to the president of the strategy and any final strategy reports thereafter, the chair and the executive director shall recommend to the president updates the commission's mission, including desired reports. B, the commission shall not reconvene following submission of the strategy until an updated mission is submitted to the president through the executive director. So then, section 7, general provisions. Nothing in this order shall be construed to impair or otherwise affect The authority granted by law to an executive department or agency or the head thereof, or the functions of the director of the Office of Management and Budget relating to budgetary, administrative, or legislative proposals. This order shall be implemented consistent with applicable law and subject to the availability of appropriations. This order is not intended to and does not create any right or benefit, substantive or procedural, enforceable at law or equity by any party against the United States, its departments, agencies, or entities, its officers, employees, or agents, or any other person. And that concludes the executive order document. So, I think the thing that I've been seeing floating around the most is where what people are been freaking out about the most has been this particular one right here. So assess the prevalence of and threat posed by the prescription of selective serotonin reuptake inhibitors, antipsychotics, mood stabilizers, stimulants, and weight loss drugs. That's the biggest one that I've been seeing people freak out about. Because I don't know where people got it from, but I've been seeing people say he's planning to ban these medications. And I can see the fear of how that could be interpreted that way, but that's not something he has said anywhere. So I just want to be like, guys, like, chill. Not only did he not say that, but there's also a lot of things that would have to happen in order for that to actually happen. Like, they'd have to do studies, even long-term studies, that come up with compelling evidence that they're unsafe and that they should not be, prescribed. And I feel like all drugs at some point, it's not a bad thing to evaluate their effectiveness. We've had drugs that we prescribed way back in the day that we no longer do because it was unsafe. I mean, we used to prescribe meth for weight loss. So, and ADHD, and technically you still can, but it's not something that we do. So it's like we've had drugs in the past that we found to be either ineffective or unsafe that we have pulled. So I don't necessarily think an evaluation is a bad thing. We have a lot of science behind it. So hopefully, it just more, affirms things that, okay, yeah, we'll keep it here. I think the biggest thing that they can do is maybe just have more information given to the consumer or the patient, kind of like how we do when we start testosterone, right? They give you a handout, tells you all the bad side effects, and you have to literally sign it. What would happen if they did that with all medications? Because there's a lot of times they prescribe SSRIs. The doctors they don't give you information about potential side effects. And all of a sudden, like, you're taking it and something weird is going on and you're just like, what the fuck? And then you have to look it up and be like, oh, God damn it. So having a little bit more information given to the patient before something is just prescribed, I don't think that is a bad thing. All medications come with potential side effects, doesn't mean that you're going to get them. But just knowing, hey, this might happen, be aware. I don't know. Do I think that any mental health drugs currently need to be pulled? Do I think that they need to be controlled any more so? No, I just think that, so a little personal story here, like the past year, I've struggled like exponentially with mental health because of lots of outside factors and things going on. And literally the first line of defense was SSRIs. And I've been on SSRIs before and I've only gotten the shit side effects. Like, I hate it. I hate how I feel on them. So essentially it was just like, no, I'm not doing this because I feel awful on them. But it was so hard to like fight off, doctors wanting to prescribe them still, instead of having other first lines of treatment, things like, ketamine or TMS or whatever. They just changed this, but in order to do ketamine, you also have to be on an SSRI or an antidepressant. And that doesn't make any fucking sense to me, to be real. So, like, they prescribed me an antidepressant, but I didn't take it. So I had to lie in order to do ketamine. They literally just changed it. So now it could be a sole, treatment on its own. But it literally is like 2 weeks, 3 weeks later that happened. But those types of things should be evaluated, especially when it doesn't make sense. So, you know, big pharma, whatever, like everyone wants to get a piece of the money. They're like, well, we'll give you ketamine, but we still want you to like take this. So, long term, we're getting something from you. I don't know. Maybe I'm just a conspiracy theorist in that sense, but it's just because I've had such horrible personal experience with them that I'm just like basically trying to push off doctors, like shoving them down my throat. And it's like, can we not be that way? I don't know.
But I also do think it might be like we're looking at it from the wrong perspective in the not in that case. Like, so what I'm thinking is instead of like, because this feels very much like we're targeting and saying that the doctors and that the people trying to that are on these medications are the wrong ones, and it's I feel like it's probably the insurance company which is pushing the doctors to prescribe it, and I feel like maybe if we were going more that route we could look a lot more at these issues, you know what I mean? Like,
Yeah. Yeah. I think, that's probably a
because I
huge
think
piece of it.
yeah, because I think that the idea of how they're framing this is what's scaring people. Because I mean, language is very important, and the way that they're putting this as a threat posed by, I think it does put that negative context over it, and I think that's what scares people. Um, do I think everybody needs to be on those drugs, or? But I'm not the one to say. Like, I feel like that should be the doctors and the patients, right? But the folks, the way that it's saying this is that the government is going to try to not saying that it's taking its bills, but it's worried about these as a threat, and I
Right.
think that scares folks.
Yeah. I don't like the word threat. I think what we're experiencing right now, like hopefully as I just want to hope that they will consider, the root cause as being how we have to fucking live our lives. If that's like that's the reality of like would
Yes.
as many people need to be on these drugs if we were not forced to live in a society that does not fit us. Like even if you're introverted, if you have OCD, if you have ADHD, we are forced to fit in a box, like to conform to a certain way that society functions when not everyone functions the same. So in order to have everyone function the same, we created these like drugs to make people like function and contribute to society instead of making, like modifying things and making it easier for people that don't think or work the same, for everyone to have equal opportunity. We're creating drugs to just help them like keep functioning and pushing through. So it's just like I don't think that is the answer.
No,
So
well, that's what I saw this thing today that was like the mental health care that I really need is for capitalism to go away, right? Like it's the
yeah.
fall of capitalism because I like if you're not on an antidepressant and you're in this world, like I don't understand how because it's like the world is what's making me depressed. Like it's not like
Exactly. Yeah.
because of these circumstances that we're living through, that is why I'm depressed. It's not necessarily that I well, yes, I probably have some issues also, but like the
Yeah. No,
just
I agree. And I think that's
like I
the
don't
crazy making thing, like we would have to change so fucking much. So it's like all we have right now is medication because we don't have another option. And there are some things that are biological that we're going to need these drugs for. I mean, OCD is biological, it's not something that is environmentally created. So a lot of times, medication, that is why, they're trying to force me on them. But I'm just like, no, I feel worse. Don't do that to me. But it's like there's some things that do need medication. I don't think that they're going to, you know, try to pull that from people who really, really need it. Uh, I think they're just trying to look at, why so many people are on these meds, which it's like, fucking duh, we know. So what
yeah.
do we do about it? Are they going to do anything, or are they just going to like blow smoke up people's asses? And is this going to address not just rich people? Is it going to also increase access to health for people in lower incomes? Are they going to think about this part of our country because they never fucking do.
No. Yeah, and it's all very scary to think about,
Yeah,
which
yeah.
makes me want my SSRIs more. So.
Yeah, it's the thing too. Like, or and the thing with weight loss drugs as well. Here's the thing: our environment is so awful. Like, you can't just take away weight loss drugs without actually creating systemic change. And I don't. Are people blind? Are they blind to how we got here? Like capitalism, as you mentioned. Uh,
Yeah.
so and it's only going to get worse because AI is literally taking jobs. All these government jobs that they're cutting. Honestly, they're probably going to replace them with AI, and that's what they're looking into. That's what I like. That's my theory. It's because they're like, we don't need people for these jobs anymore. We don't want to pay anyone. We're going to save the government money. Uh, and then we've got Elon being like, we'll give people $5,000 checks for for the money that we've saved. And we're like, that sounds like it's not going to happen. But also,
No, it's not going to happen.
can you not give us checks and then like just bring down inflation and food prices? But at the same time, is this a stepping stone to something like universal basic income? Because eventually there is not going to be enough jobs to go around because AI is going to just get better and better and better. It's already starting to take over jobs. So what do? We're going to eventually run out of jobs for people. And how are you going to make money? So I think at some point we do need universal basic income. This is something that Andrew Yang, when he was running for president way back in the Trump era, was trying to present people. He was way ahead of his time in being like, AI is going to take over the world. And people are like, you're fucking crazy. And he wanted to implement like a $2,000 a month, universal basic income. And I feel like we're getting to that point where this needs to be a discussion. And I'm thinking, is this secretly behind closed doors, like part of the discussions are realizing, we're running out of jobs, or is this just something stupid that Elon came up with? Fuck, I don't
I
know.
feel like I just don't feel like they're even thinking that far ahead. I think they're just like, we don't want these. They don't need these jobs,
Yeah,
and I don't. I honestly don't think they're thinking that far ahead, but I kind of hope they are.
I mean, I hope so. You would think that maybe they would be, since Elon is like literally creating AIs, so you would think he would be more conscious of the potential, like, oh, this has the potential to replace basically all these jobs. So what are we going to do? Uh, but I just don't know that he has enough compassion or care.
Yeah, I don't really see him looking out for the greater good in any sense, but
No.
we'll
And
see.
considering he has enough money to like feed the whole world and he's not, that's a red
Yeah,
flag.
exactly. So make us
Yeah.
feel better. What do you got for our power talk today?
Um, Power talk. So here we are. So every day you must unlearn the ways that hold you back. You must rid yourself of negativity so you can learn to fly. So rid yourself of the internet negativity so you can learn to be happy again. No, I'm just kidding. We weren't happy to begin with, but yeah. Basically just be careful of what you're consuming. Do your research. Try not to take headlines or people's tweets, threads, blue skies, whatever you're reading. What do we call blue skies?
I don't
Tweet.
know, but that
Uh,
sounded funny.
blue skies, whatever. Just be careful because there's a lot of things that are taken out of context. There's a lot of things that haven't happened yet. And I know we talked about this before, where just try not to live the moments that have not happened yet, because then you have to either go through it twice or you're just living through something that isn't necessary. Always be aware, of course, of the potential, pay attention, but do your research. Like, don't just jump to conclusions, and look at what something might mean, look for context. And I think it just stems from seeing a lot of people being like, he's banning SSRIs. What am I going to do? It's like, whoa, let's pump the brakes. That's not happening yet. Like, let's chill and let's be real. It is not in their best interest to just ban psych meds because woo. Yeah, no.
Not with everybody this close to the brink already.
Nah, we've got all the anxious people that are, like we're currently on anxiety meds, like freaking out because we have anxiety. It's like,
Yeah.
can you imagine without medication how we would be reacting? So please don't.
Oh goodness. Well, until next time, hopefully we got some good news coming this coming week, and hope everybody has a good one out there.
Yeah. Peace out.
Bye.